Good morning, everyone. Hope you're doing well as I get myself adjusted. There we go. Perfect. Okay. So today we're going to talk about shoulder pain and the effect of your shoulder on your overall wellness and health. So is it really the shoulder pain or is it just a referral pain pattern? A lot of time, my name is Dr. Romina. I'm a chiropractor. I've been in practice for over 25 years, and hopefully my knowledge and experience can shed some health and wellness during this precedented time. My goal is to add more value to your life, give you some health tips so you become smart people instead of patients who need help. All right. So this is mainly a community service from my part, and I hope you will share this with anybody that you know. So here we go. That's obviously hair and makeup, right? Okay. My office is in Los Angeles, California, and if you have any questions, you can always contact me through email or call us. We'll be happy to take care of you. All right. So what exactly is shoulder pain? Shoulder pain arises from the shoulder itself, and it can contribute because of muscle problems, neck problems, mid-back problems, or even your scapula not being in the proper position. So if you see dysrhythmia, where it says scapulohumeral dysrhythmia, we're really talking about the shoulder blade and this humerus right over here. They're not working together. So I want you to visualize a hinge on a door. If the hinges are not properly positioned and they're out of alignment for any of the reasons that has been mentioned above, then it's very possible that your shoulder, you will experience pain and discomfort, right? As usually starts with limited range of motion. Also, 40% of the shoulder pains is when you have, when it's an over repetitive movement above the head. So any kind of serving, throwing, pitching could be considered to cause shoulder damage. So we're talking about tennis, volleyball, pitchers, and also football quarterbacks. They tend to have a lot of shoulder injuries. It also could be from your neck. So we'll discuss and we'll dissect it as we go through what could be your shoulder pain. And is it really coming from your shoulder or it could be something else? Let's break the anatomy of the shoulder down. So what I want you to do is I want you to take your fingers and start palpating. Oh, this is my mask. So here we go. Start palpating your clavicle bone, right? The bone in your clavicle or your collarbone. And if you start touching your collarbone, move it all the way to your shoulder joint. And if you feel a little dip, that is called your AC joint. That is called the acromion. That's the tip of the scapula. Your shoulder blade has a little bone that curls over and it connects to your collarbone. This is your AC joint, most commonly affected in any kind of athletic injuries, also affected with people who are rounded shoulders. So any of you listening, thank you for sitting up straight because that rounded shoulder is aggravating this problem. Then you have your scapula. Your scapula is your the shoulder bone or the bony structure that looks like a triangle in the back of your spine that sits on top of your rib cage. And the clavicle, which is right over here, and humerus is this ending bone. So if you grab your shoulder right now, and if you look at the deltoid muscle, that deltoid muscle fully covers the head of the humerus. So your scapula creates a little half moon crescent shape, has a little crescent shape area where we call glenoid, right? The humerus looks like a bat, sits like this directly on top of the humerus. However, there's not much stability there. It's easy to fall. So what happens, the body starts covering and connecting these two structures by a group of tendons, muscles, and ligaments, also known as your rotator cuff. So basically they come in like a cuff, they wrap around here to stabilize the humerus on the glenoid, and they allow you to rotate. So therefore, your shoulder can easily rotate in 360 degrees of movement. So I want you to do something right now. I want you to slouch. Yes, you can, even though I'm all about against slouching. I want you to slouch and make a circle with your arm. Try it, it won't hurt. Now, what I want you to do is sit upright and rotate your shoulder. Now, by sitting upright, did you notice a difference? Did you notice a difference in your shoulder movement? So this is the importance of a rotator cuff being able to function at their optimal position, right? Now, how does the shoulder affect your body? The pain is on top and the outer side of your shoulder. It's worse when you lift your arm, especially above your head. So that means that's 40% of the people that are suffering from shoulder problem. You feel pain, you feel achy, especially at night when you lay on it, and it can affect your sleep. So you're constantly tossing and turning. And you have weakness in your arms. So you have a difficulty at a certain position opening a doorknob, at a certain position opening a jar. So those are the factors that could affect. So there's different conditions in shoulder. There we have frozen shoulder, we have shoulder impingement, we have rotator cuff tears, typically caused if you're in a car accident or you've been in a car accident, your hand is on the wheel and you get rear-ended, it's very easy that your arm is stable, right? And then you get a blow that goes from back, so your shoulder moves forward and back, and that can cause tearing of the labyrinth, ligaments, tendons, and even cause synovial fluid inflammation, which we'll talk about later. And then you could also suffering from shoulder instability. Okay. So typical symptoms, frozen shoulder usually is as a result of not moving your shoulder for a long period of time due to chronic disease or chronic pain, and then the structures around the shoulder start stiffening up. Then you have shoulder impingement, which means that when you move your shoulder, it pinches, and that creates a pain, typically caused by misalignment, subluxation, trauma, or injuries. And it's very important you get that fixed, because if you don't, you will cause early wear and tear in the joints. Then you have rotator or labyrinth tear, which is definitely more of a deeper pain, but it affects the front and top of the shoulder, and is typically a direct blow, car accident, fall, sports injuries, work injuries. So it's usually trauma-induced. And shoulder instability. Shoulder instability typically happens if you have kids or adolescents that are in sports and athletes, especially baseball. As the body is growing, the over repetitive injury of the shoulder and ligaments can cause an instability in the joint and the supporting structures. So repetitive stresses are immediately affected. And here we go. So those are the four major parts of shoulder problem. But a lot of times you could have other factors causing shoulder pain. So let's talk about you. Let's talk about you and you working at home. So due to changing your workstation from a very nicely set up corporate ergonomic chair and desk and the placement of an ergonomic workstation, a lot of you could be suffering from moving your workstation from the bed to the kitchen counter to the coffee table, back on the couch, and then on the floor. So, or moving in certain positions. So being creative at home is kind of hard, but your posture can immediately affect your neck and upper back problem. So when you're sitting and you're having a poor posture, it's not just affecting your spine, but it's also affecting the rest of your body. So forward head position, slouching in front of your workstation can definitely affect your shoulder pain. Why? People slouch, and the whole slouching process is three parts. First, you slouch with your thoracic spine. And if you remember from previous right here, we were talking about how the thoracic spine dysfunction can be contributed to shoulder pain. So that's where that is coming from. And then the second part is rounded shoulder. And then after rounded shoulder and slouched thoracic spine, your head has nowhere to go but go forward. So these three components can be a major contributor to your shoulder pain. Now, Shoulder also comes from a referral pain pattern. It could be either from the spine or a physical problem, which is shown in this picture. A lot of contribution of shoulder pain could be coming from the neck because the nerves that exit out of your cervical spine and your neck, they feed and control your whole upper body, upper extremities, shoulder, elbow, fingers. Now, anything that is from your C5, C6, middle of your neck, mostly affected with forward head position, affects the front of the shoulder or whole entire shoulder area. Also, if you look at acupuncture and other natural studies, your liver and your gallbladder also refer to your shoulder problem. Gallbladder and liver refer to shoulder. Diaphragm and lungs is the junction between your neck and your shoulder. Typically, if you're not sure about it, slouch when you're slouching and when you have poor posture, your whole entire rib cage compresses, and that definitely affects it. Stomach is the middle of your back, and also we definitely don't want to eliminate the heart because the heart, lung, and area are the same anatomical location. They will affect your more pectoral area. But check your spine, check your organs, okay? So if you have symptoms of gallbladder problems and liver problems, check with your doctor first to make sure that we rule that out. Then we address the more physical problems. Now, also, let me talk to you about forward head carriage. Let's see if you even have forward head carriage, right? You probably have seen other people who stand or typically have this whole head forward posture. Who is mostly affected? I will tell you, waitresses, especially if you're in food and beverage industry, you tend to have more of a forward head carriage if you're not already an athlete or a dancer who concerns about their posture. But the average people, they tend to have more of a forward head carriage. If you're in any kind of service industry, dental hygienists, nurses, hospital workers typically tend to have more forward head carriage. Therapists, life coaches tend to also have that kind of a body position because it's just a body position of helping, and it's more of a repetitive injury. And this is not a factual thing. This is basically based on my 25 years of experience dealing with different types of patients. But let me give you an objective way of measuring and evaluating if you do have forward head carriage. So look at the picture over here. The big circle is your earlobe. The little circle is middle of your shoulder. So if you're just sitting there or if you're just standing, I want you to sit like you normally sit. Don't be upright. Don't try to correct anything. But look at the position of your earlobe. If you draw a straight line, does that line up with the middle of your shoulder? If it does not, let me tell you, you already started the initial phase of forward head posture problem. So for every 1 inch that your earlobe is in front of your shoulder, there's an extra 10 pounds of pressure up on your upper back and 3 times more on your lower back. So if you are an attorney, an accountant, if you have a desk job, a blogger, or anybody that's sitting in front of a computer for too long, don't be surprised of having low back problem really coming from your upper back and neck. Because if for every 1 inch forward head position, you have 30 pounds of pressure on your lower back, imagine if you're really hunching over in front of your computer or on your keyboard or on your desk, right? So forward head position is a major contributor to shoulder problem. It affects your posture. It will cause pinched nerve to the nerves and the vessels that are coming out of your neck. It can cause thoracic outlet syndrome, which means that you're getting this numbness and tingling down your arms. It can cause muscle sprain, muscle tightness. It can cause chronic strains, which you get like repetitive injuries, wake up with stiff neck. Sorry about that. And also early degeneration of. So people don't wake up with arthritis in their neck. They don't wake up with bone spurs. They don't wake up with blown out disc. They work their way through it, okay? So please be aware of the importance of forward head posture because up here affects the rest of your body. So rounded shoulder is the second component of poor posture, which some of you might be attending right now. It could simply be that you don't have those major problems. You just have what we call upper cross syndrome, which means that the upper back and the front of your body tends to be tight, and you tend to have the upper front of your body and the mid back tend to be weak. So what are the muscle groups you need to work on? You need to work on your upper trap, stretching them, and you need to stretch your pec and your upper abdominal area. But you need to strengthen your neck flexors and your back muscles, middle back. So we're talking rhomboids, lower traps, sartorius anterior specifically, to bring your body into upright position. I don't know about you, but I don't know how disciplined you are with your exercise routine. I like things that are done as fast and as efficient as possible, and that's what we practice in the clinic. One of the things you do want to consider is having a posture support that corrects your posture during your 7 to 8 hours of activities of daily living, because that makes a repetitive change. So instead of repetitive strain, you're doing repetitive correction at a micro level, which has a huge impact, because maybe you're not as disciplined like a lot of people, or you're not able to go to your physical rehab or chiropractor or physical therapist office. So having a posture correction helps you be, one, cognizant. It's a constant reminder of being upright, which is almost like hacking the nervous system. Or, well, what you can do is just wear a posture support to be upright and help your body be upright, and exercise with that to accelerate the changes. So I'm a big advocate of a posture support. Just make sure it doesn't compress your armpit, because if it does compress your armpit, you get thoracic outlet syndrome, which defies the whole purpose. Neck problems are typically pain pattern of neck problems. If you want to know if you really have a shoulder problem, you have a neck problem, I want you to look at that. If it's distributed and diffused and it involves your upper back, you're looking at C5, C6, which is the most common. It overlaps with C4, C5. And if you want to know where those are, take your 4 fingers, put them right behind, your little finger goes under your hairline, and your lower finger should be around the junction between your shoulder and your neck. Put it right behind your neck. Your third finger is exactly where C5, C6 is. That's in the middle of your neck. And if you push around that and you feel pain, you have a cervicogenic problem causing your shoulder problem. So it's a secondary factor. Now that I talked about all the problems, let's talk about how do we treat it? Like, what is the best way to do? I want you to remember something that's so important, and that applies to not just your shoulder problem. That applies to any physical injury to your body. So we talk about any musculoskeletal problem, you use what is known acronym of PRICE, which you protect the area, you rest it, you ice it, you compress it, and you elevate it. You allow the body to go through its healing process. So this can happen, let's say you put a couple of pillows up on the bed, rest your shoulder, or elevate your arm. So those are the things you need to do, and listen to your body. Your body is your guide, your coach into reducing damage. The one thing you have to do is just baby it and take care of it a little bit. We'll be more than happy to take care of you. I'm sure you can contact any of your chiropractors, your physical therapists, your orthopedic surgeons, but you need to pitch in your part as well to help take care of your shoulder, okay? So next one that I'm going to talk to you about is stretching and stretching. Obviously, it's extremely effective. You could do yoga stretches, general shoulder stretches. You can find anything on Google. You don't need me to give you, even though we do provide exercises and stretches on this particular PowerPoint, which is available to you on our website. Or you can take screenshots while I'm talking. But stretching is very important. Exercises are even more important. When you have a shoulder injury, please note that you're having a weakness of a group of muscles and a tightness of the other group. So you stretch the tight area and you strengthen the weaker ones. There's no point in going through all that effort and energy if you're going to be exercising and stretching in poor posture. So before you do any stretches or exercises, correct your posture, even if you have to fake it, exercise, and then you notice a massive difference. It's definitely hacking the whole nervous system. And there are some home tools, which I will explain to you, home tools for shoulder problem home tools, for neck problems home tools, for posture, depending on what you have already gathered that could be your problem, okay? And if you still have any questions, we're here for Q&A. And you got medical part. So the medical part is non-steroid anti-inflammatories such as Motrin, ibuprofen, naproxen, are the ones that your doctor might recommend to get through the pain as you are doing your conservative care. Injections, you have PRP, you have stem cell, you have cortisol injections, and those are all the ones that you can have an option to. I think PRP helps very much based on my clinical experience. PRP helps with micro tears. If you have a full tear of your shoulder based on your MRI findings, you will not benefit from PRP. So don't waste your money and don't waste your time. You need to go directly to surgery, all right? And keep it stable by doing the exercises and getting physical rehab. But for those of you who are not there and you don't have an MRI that indicates, or you just have shoulder aches and pains, let's try these conservative methods. And if the problem goes away, perfect, check. If the problem doesn't, seek further care. An X-ray of a shoulder is not going to give you anything but alignment issue. What you need for your shoulder is an MRI. And an MRI truly gives you the soft tissue injuries. And why? X-ray tells you if you have a fracture, if you have a displacement. But MRI will give you soft tissue, muscles, tendons, ligaments, impact. And if you recall, the anatomy of the shoulder was that you have the scapula and the glenoid area, and here's the humerus, and it makes the glenohumeral joint. Most of it is controlled and connected by soft tissue. So an MRI will give you the whole rotator cuff integrity, and that would help you. And again, if you have had shoulder problem, you can't just treat the shoulder and call it a day. You do have to take care of your neck, and you do have to take care of your mid-back and your rib cage area because they're all connected. It's that simple. So, treatment solutions. First and foremost, fix the ergonomics of your work, all right? I like the concept of keeping it simple. Your torso has to make a 90-degree with your thighs, 90-degree with your legs, okay? You can change the angle of your leg depending on your seat pan of your chair. Also, increasingly important is your elbow rest. If you rest your elbows on the elbow rest, your shoulders don't have to shrug up. That's number one key. If you're standing, just really focus on relaxing your shoulders. Or you could cheat like I do and wear a posture support. This is BAX-U posture support. I chose this because it does not compress the armpit and is adjustable. So I could, I look up to put it on. The reason being is it helps activate my extensor muscles, because remember, they were the upper trapezius were the weak ones in a rounded shoulder. So you look up, rotate the shoulder back, set it, and forget it, right? We all know that part. Okay, great. So next one, ergonomics is very important. You can Google that. Again, this PowerPoint is for you, and we've had PowerPoints in the past that you could find from our website in more detail about ergonomics and how to sit, how to stand. Those are important. A couple of tools you can use, definitely. Wear a posture support. For those of you who feel really tired at the end of the day, breathe. Take a deep breath in from your belly and exhale and relax your shoulders. That by itself is a diaphragmatic exercise, which helps your thoracic spine or your mid-back. So you've already hacked it without even any other tries. Phone stand is extremely important. You could get something like this from Amazon. You could get it from our website, not a problem. Laptop stand and the more complicated version. Those are great tools you can have. Also, exercises and stretches. You could definitely do wall angle exercises. You could do prone Y stand, which you could use the rollers, roller foams if you're at the gym. For those of you who are actually have your gyms open in California, we don't have them all open, but if you could just, you could do snow angels, it's that simple. Prone exercises on your stomach or on your back exercises, all are effective. TheraBand or exercise bands are also very important. Planks and downward dog are extremely effective. If you are if you have rounded shoulders, don't do planks because you might actually make it worse unless you have somebody who's doing who checks you in your proper positioning. I do recommend, this is the posture support I was telling you. Comes in black and white. It doesn't pinch the skin. It doesn't shaft. It's made from silk, so it's comfortable. And it also has room for a big lunge in case you had a big lunge. Exercises that you want to do. The first one is called Codman exercise, especially if you're having a pinching. This is a perfect exercise. Grab something that's a heavy weight. Hang or almost traction. So you really want to just traction the shoulder joint about 20% of your traction feel. Typical stretching of the shoulders, TheraBand, or stretching the torso. The second exercise, this one, the key is to keep your elbow to your side. If you're lifting up your elbow while you're exercising for your shoulder, you cause more damage. So don't do that. They call these flies when you can practice flies. You could do supine flies. This is very great if you have acute pain. If you're building more strength, make sure that you use the TheraBand. You could get that also from the website or from Amazon, wherever you like. Then let's talk about sleep. For those of you who lay on your side and you have shoulder pain and you have to lift up your pillows or add pillows or put an elevate or change your position, let's talk about the type of pillows you need to use for your neck, because your neck position can contribute to your shoulder problem. So there's two different types of pillows you use. You have the pillow that are feel good because you just like that consistency. And you have the pillows that are ergonomically or mechanically designed to promote better spinal and musculoskeletal health. So one is a feel good and the other one is a mechanical aspect of that, the functionality, right? So the pillows that I recommend, and I'm not having any names over here because I really want you to choose whatever brand you want. And that is number 4, 2, 4, and 6 are my favorite pillows for shoulder problems. The reason being is they support your neck the most. For those of you who have straight neck, don't waste your money on number 1, number 3, number 5, and number 7. Just don't. You make your neck worse. So don't do that. Get something that supports your neck while you're sleeping to promote the curve in your neck, especially any pillows that have that curving option for your neck is going to be very effective. Now, there's also other products that you can get. If you're feeling radiating pain to your shoulder and mid-back, that comes from your neck area up here. If you're feeling any pain in the first 2 fingers, that looks like a figure, that looks like that, that's like 6, that's from your 6th vertebra in your neck. If you're feeling anything in the middle of your finger or your ring finger, that is coming from number 7, which is the junction between your neck and your upper back. And if you're feeling anything in the little fingers, those are the nerves that are being pinched a little bit lower where your t-shirt collar sits. So to take care of that, I created this whole combination of stuff that you can use. First, you need to get your BAX-U posture support because there's no point in making things worse, right? So you definitely want to wear that during your work time. And if you exercise with it, you increase your ability to heal by 10 times. So if your time and money is efficient and it's important to you, wear the posture support while you're doing your exercises. This is a neck hammock. You can buy it from our site, you could buy it from Amazon, wherever you like, that's your choice. This is a resistive band that gives you corrective exercises, and you definitely want to get these massage balls because the massage balls you can do trigger point therapy. Most of these symptoms are also aggravated or the muscles go into a spasm and they trigger Certain points in your muscles trigger the pain. That's what called trigger points, okay? So using the massage balls is going to help you reduce the spasm and tightness in the trigger point. If you have radiating pain because of your neck, this will help you. If you have chronic stiffness, so you're not having the radiating pain, you're just having the achiness around your neck and shoulder area. It hasn't gone to your back, it hasn't gone to your arms. This is a better set, that tool that you get. This is more for a chronic neck, especially for those of you who have shoulder, neck, and headache combined together. This combination gives you a great relief. Again, stop the aggravation with your posture corrector, protect your neck, get rid of the trigger points, and strengthen your back. With the TheraBand, with the resistive figure eight, there's two groups of muscles you can work on. You can work on your shoulder, and you can also work on your torso muscles. So the exercises you get with this kit is going to be specifically for your torso and for your posture stabilizers. So you do have options for posture products. Why do I recommend BAX-U? BAX-U specifically gives you a dial tone with your shoulder, because not everybody has the same posture, right? Some of you have really rounded shoulder. Some of you have forward head position and rounded shoulder. Some of you don't have forward head position. You just have this slouching and roundedness, okay? So you can dial this according to your liking. Some days you wake up and you want to take on the world. Look up, pull, and close. Then on top of that, this particular posture product is covered by your Flex Spending Account Health Savings Account. Why? Because it is considered a medical device to protect the shoulders. And because it is backed by university studies and by corporate wellness studies. So if you are offered FSA and HSA from your work, make sure that you use this, and it's definitely a posture product. All right. Other products. You probably have seen something like this, like that, or like that on Amazon. The problem, the common denominator between every single one of those is it compresses your armpit. You have a group of nerves that come from your neck, remember, and they run through your armpit and go to your fingers. They all merge here. We call this axilla or brachial. When those posture supports compress your armpit, they actually cause more numbness and tingling and weakness in your fingers. Here, here, and these two, right? So don't waste your time, don't waste your money, get something that is effective, all right? So I hope this was an effective PowerPoint for you. I hope this was effective presentation. This is what I do with my patients throughout the week. And throughout the years, I've been giving a lot of recommendations, because it's not the matter of how much you spend with me or with your physician or with your therapist. What matters is the 6 to 8 hours that you are at home aggravating the problem. So be smart with your time, be smart with your money, and do as much as you can on your own before you schedule the next appointment for your doctor. So I want to thank you for attending. I'm sure you have other things to do. I hope this information was effective. I hope you can share this with other people. That means that I've done my job. And every Wednesday I bring you a different topic and different health hacks to help you. So the next one is going to be carpal tunnel. So we're going down the body, right? And what are the home solutions? What are your treatment options? And as a very smart person said, an ounce of prevention is better than a pound of cure. I think that was Albert Einstein. So I want to thank you again for your time. Thank you again for joining us. We're going to send you have you take this survey. And this is a survey that I designed so that way you would know exactly what could be your risk potential. So answer these questions and we will give you an email of what is your risk potential and what you need to do for it. Again, thank you for your time, and I hope this is effective. Don't forget to fill out the survey, and we'll see you next time. Take care and have a wonderful, see you next Wednesday.